Hello everybody, my name is Dr. Pratik Surandashe and I am a consultant psychiatrist in Borivali, Mumbai. In my talk today, I will be covering geriatric and women's mental health and specifically how depression affects them. But before I do that, I want to bring to your notice that after ischemic heart disease, depression is the leading cause of global disease burden. It's the second most common reason why people lose their life and there is morbidity or mortality in the world. I also want to give out a shout out to champions of mental health, mainly Deepika Padukone and Virat Kohli. Now let's begin. It is said that the greatness of a nation can be judged by the way it treats its vulnerable population. Now, in India, the vulnerable population are the children, the women, and the elderly. In India specifically, women go through a lot of changes. These are other than physiological. Socially, when a lady gets married in India, she has to leave her parents' home and has to go to her in-laws' home to stay with her husband. Physiologically, the body of a woman is changing constantly from the time she attends menarche till the menopause. So I am here to talk about the changes that happen in women, specifically how they change during depression. So the changes can come when the lady attends menarche, and it is called, very commonly it is called premenstrual syndrome or premenstrual dysphoric disorder. It is a very common scenario in today's world. It affects 1 out of every 10 women. The symptoms that a lady faces is easy irritability, low mood, anxiety, insomnia. The reason for this is mainly the hormonal changes that occur during menarche or during the menses. There is fluctuation in the hormonal level, specifically of estrogen and progesterone. The next disorder that I want to cover is basically postpartum depression and baby blues. Now, this is seen very commonly in first-time mothers. Baby blues affects almost 8 out of 10 women. The symptoms that are seen, and to remind you again, baby blues is something very normal, and it is characterized by a woman who's a first-time mother and who feels very low, has anxiety, has insomnia, easy tearfulness, and gets an overwhelming feeling every time she thinks about the care of her infant child. But this typically gets over by the 10th day. It starts when the lady leaves the hospital on the 3rd day post-delivery and has to go away, and it does mostly go away by the 10th day. What happens is, again, there are fluctuations in the hormonal level in the woman and she experiences these symptoms. In contrast to postpartum blues, postpartum depression is a very big problem. In postpartum depression, the chances of harm coming to the mother and the child are more. It occurs in 2 out of 10 women. Almost 25 to 50% women facing postpartum blues can also progress to have postpartum depression. In postpartum depression, the woman has intrusive thoughts, repeated thoughts that she cannot stop about her death or the death of her child, or she also gets violent thoughts, and there is a lot of guilt, there is hopelessness, there is worthlessness, there is a lot of fatigue that comes, and it is really troublesome for the lady. It is important to remember that occasionally a depression episode can start even during pregnancy. Occasionally the woman in these scenarios might have a family history of depression. It is important to also know that the women who are faced with challenges, as in they are unemployed, or they face poverty, or there is a constant conflict in the family, or there are a lot of interpersonal stresses during the marriage, these factors also predispose the women to get postpartum depression. In these scenarios, what is necessary is really to understand that the woman generally requires a lot of social support from the family, timely counseling, and alert mind to notice these problems will help the woman in a long way. Generally, in India, the family is revolving around the lady, and if the lady's mental health is great, the family's life is great. Alright. Another point which I want to make with regards to postpartum blues is that it recedes on its own, and the woman generally has a positive outlook towards life and is looking forward to bonding with her infant and wants to take care of the child. Now this is in contrast to postpartum depression, where the lady doesn't want to take care or feels or has violent thoughts with regards to herself or the child. Now we come to the other end of the spectrum in a woman's life, that is when a woman attains menopause. Now during menopause there are other things which are happening in her life. Number one is her children have grown up and become adult and now leaving her home. It's mainly a feeling of having an empty nest. The other problems are that the lady can be faced with the mortality of her parents. There can be always there is the estrogen level has gone down, and there are vasomotor changes which come up, mainly anxiety. It also gives rise to hot flashes and feeling of being on the edge constantly. Now during this problem, a woman can be helped with either hormone replacement therapy or counseling and psychiatric medications. Now I come to the second part of my talk, which is about geriatric mental health. The worst thing about really having depression in a geriatric age group is that the world is plagued with ageism. Now ageism means that wherein a person feels that depression is very common and an old age person is supposed to be depressed. Now I want to get to your notice that the chances of completed suicide, that is a person dying after suicide, the chances are very high in a case of geriatric depression. There is a high amount of hopelessness and worthlessness that is there. But the best thing really in geriatric depression is that they don't require that much amount of counseling or medications. The dose has to be really low. And once treated, the geriatric age group people, they become okay and can function again. The causes that are there when we see geriatric depression are mainly the loss of a spouse, that they have a constant fear of facing their own mortality. They have social isolation where they can't meet their children, or it's a nuclear family and the children or the grandchildren stay away. They also feel worthless because they can't contribute financially to the household. They can also be faced with physical problems, mainly arthritis, diabetes, heart disease, stroke, which really gives a big blow to their self-confidence. Now, the only thing to be remembered about geriatric depression is that it can be treated and the person can get a second life. So, I want to urge everybody to end the stigma and talk about depression because it is easily treatable. Let's talk about it, end the stigma, and get better. Thank you so much.